For this module's practice clinical pearl, I want to talk to you about how the concept of trial and error. And one of the things that practitioners make the assumption for is that they should immediately know what they need to do and come together with a treatment program and have an outcome right away. And that's not how things really work. Now, you'll notice in the case studies, when you look at their file, there's an important question I ask, actually two important questions I ask. What things have ever helped you and what things have made you worse? And that's in a sense looking at trial and error they've already done. And it's very useful to know that information to get an idea of which mechanisms to apply. A lot of times you just incorporate all the things they've already known to help and create a model over that, and they just stay focused and concentrate on that, getting a big change. Now, the trial and error mechanism is something where you have to just embrace and accept, because when you're working with chronic patients, you don't know what's going to work. You don't know if anything is going to work. People get progressed enough, there's a strong possibility that everything you attempt to do will not have any impact at all. And there's also times where you think like a mechanism may have a huge impact on their health care and their symptoms and function, but it may not. So you may see someone with chronic pain and inflammation, and you see they have leaky gut intestinal permeability and lots of food sensitivities, and you may remove all those foods and actually see a pre and post change in their leaky gut, and it's fixed, and there's no change in their pain. And you thought it was going to work, but it didn't work. It may have changed the physiological change, but it didn't make a big difference in their symptoms. And that's normal. And that's part of the practice of functional medicine. So you have to be comfortable with that. If you don't, you're going to completely burn out when you work with chronic patients. So as you can see through this Mastership program, we have these patients now that we've been following, some of them for a year now. And you can see some things, some interventions have worked, some interventions we thought worked in, we changed it, we moved into different ones, and that's okay. Now, if you understand that concept, it makes it much easier to go into a chronic practice where you don't have all the answers, where you have a bunch of hypotheses of what interventions may work, and then you work through it with the patient. Now, this could only work if you explain the process with the patient. So saying, listen, you have so many things going on. These are the things that are possible. I think this will be the best approach for now. Let's see how you do. If you respond or don't respond, it is diagnostic. Now, sometimes if you're stuck with more than one protocol, like maybe you want to go after, let's say you have a chronic pain patient. Maybe you want to go after leaky gut. Maybe they're just hypothyroid and thyroid hormones not managed properly. Maybe the chronic pain may be environmental allergens or just the quality of air in their home or other factors. And it's probably a bad idea to do everything at once. Because if you do everything at once, you don't really get to see what works. That's another important concept, is when you do trial and error, you don't really know what works or not if you're doing 10 things at once. So let's say in that situation, you go, hey, why don't the most important thing for you is to get your TSH under control. Let's see if that normalizes your other symptoms and to what degree. Then if they do that, let's try to improve the air quality in your home for your chronic pain inflammation. Let's see what kind of change we get in the next week or so when you implement that strategy. And then you kind of go through, or maybe you work on the leaky gut or the other thing for a while. And sometimes if you don't know where to start, just go, what do you think is the best place to start? What would you like to start? They go, well, I really think it's leaky gut, and I really want to go for these foods things first. Great, let's start there. And then as you're working through that, you get an idea of how things are changing, and you go through it. One of the biggest mistakes people do is they do too many interventions all at the same time, and they do too many interventions all at the same time. They don't really know what's working and not working. When you're working with a chronic disease patient, you're pulling on the strings and you're hoping something has an effect. And if something has an effect, you just pull deeper and harder and just go down that pathway. So it's almost like a little bit of patience in doing some intervention, seeing the outcome, doing an intervention, seeing the outcome, and having that communication back and having that patient understand that. Now, when you go into chronic disease practice with the mindset of, okay, we're going to have a lot of things that aren't really clear. We're going to have to do some trial and error to see what things make a big difference for them. It completely changes your work environment. If you go into a chronic case with a mindset of an acute model, meaning you're expecting to have a protocol that's immediately going to make a change for them, and you if you don't get the outcomes right away, you miss the diagnosis, and you know what you're doing, and it's gonna cause you to burn out. It's gonna also make you not have the ability to have patients follow through and work with you over a period of time. So this happens all the time. You see like new practitioners don't understand the concept of trial and error, jumping in because they really are convinced that what protocol they're going to do is going to be the one that makes a difference for them, and they're going to nail it right off the bat, and they don't, because that's what happens in chronic disease practices. And all of a sudden now the patient's like, well, you really were confident this leaky gut protocol was going to get rid of all my pain, but it hasn't. So how do I trust your next approach is going to be appropriate? So that's the difference between being able to have the time you need and the emotional endurance you need from the patient and the trust you need from a patient to work through it when you have a trial and error model that you explain with the patient, versus being overly confident and not really doing trial and error, just thinking you're going to nail the diagnosis right off the bat, and creating that model for you and them and for your practice. That's a terrible model. It's going to cause problems for you. So I think it's really important you just understand the concept of trial and error, and you really explain those concepts to the patient and get the patient involved, what they think is the most appropriate. And then when you know the interventions you're doing are going to be diagnostic, and you want to know, did this work or not work, the patients can be much more compliant following through, and they're also going to be much more responsive to keeping track of their symptoms and if it's working and not working. And they will also be not as discouraged if things don't work, because they know there's a possibility this may not work. It's okay. We have other things to try, but this makes the most sense based on everything else to try first. So then you have the time and endurance you need to work them through the case. So one of the biggest concepts that will really help you in a chronic disease practice is just the principle of trial and error when it comes through with your patients. I hope that's helpful. Thank you.